Good afternoon. Today morning, I talked about background of lateral approaches, and today now I'm going to talk about the technique, the actual technique. If you're interested, please take pictures. There are some barcodes that take you to additional material for more information. But more or less, we talked about that it's not about the skin incision that makes a MIS procedure, MIS surgery, but what happens under the skin, meaning the minimal disruption to surrounding tissue. We talked about that. I'm talking about the muscle sparing technique that are lateral and posterior. Obviously, we are not talking about oblique anterior interbody fusion or oblique interbody fusion anterior to psoas. It is practically the lateral position, and as well, we not talking about the lateral approaches. We are talking about oblique lateral posterior lumbar interbody fusion and practically a prone lateral position that we call MIS-DLIF. Now, the difference between these two approaches, if you're anterior or posterior to the nerve root, this is an oblique view. For that reason, here the transcambina approach seems bigger than the lateral approach. In reality, the lateral approach is bigger, and as well, it doesn't confine the ganglion or nerve in a triangle. The footprint of the cage that is put in is much smaller, so the chance of the nerve injury actually is lower in a direct lateral approach compared to regular lateral approaches. But more importantly, if you're interested, there are additional papers, these two papers that describe the technique, where you see in the lateral and prone lateral and AP position, the tip of the probe where this procedure are practically performed anterior or posterior to the nerve root. More or less, the definition is if you are anterior or posterior to the nerve root, both procedures are done with identical instrumentation with different angle and starting point to the disc. Again, if you take this barcode, you see additional setup for the surgery and necessary steps. 2 C-arm are required for this procedure, so you have in real time actual position of all the damn it. What's going on here?
I think Yemen bombed Israel.
Who?
Yemen.
I heard that. They sent some rockets or something.